A very warm welcome to everyone joining today's session. Today, we'll be diving into an essential part of your FMGE preparation. Our goal in this session is to break down key one-liners and previous year questions to help you understand not just the what, but also the why, so you can confidently apply this knowledge in the exam and clinical practice. Let's begin with the subject of anatomy. In question 1, you are asked to identify the marked structure in a cross-sectional image of the thorax. The options are option A, right atrium, option B, left atrium, option C, right ventricle, and option D, left atrium. The arrow in the image points to the most posterior chamber of the heart, which is the left atrium. The most anterior chamber is the right ventricle. The correct answer is option B, left atrium. In question 2, you are asked which of the following forms the boundary of the marked structure. The options are option A, extensor pollicis longus, option B, extensor pollicis brevis, option C, adductor pollicis longus, and option D, adductor pollicis brevis. The image shows the anatomical snuff box, which contains the radial artery. Its medial boundary is formed by the extensor pollicis longus tendon, and its lateral boundary by the extensor pollicis brevis and abductor pollicis longus tendons. The correct answer is option A, extensor pollicis longus. In question 3, you are asked to identify the vertebral level for the red-colored plane shown in the image. The options are option A, T12, option B, L1, option C, L2, and option D, L3. The red line aligns with the subcostal plane, which lies at the level of vertebra L3. Other important planes include the transpyloric plane at L1, the supracristal plane at L4, and the intertubercular plane at L5. The correct answer is option D, L3. In question 4, a newborn presents with a congenital defect, and you're asked to identify the developmental cause. The options are option A, failure of closure of anterior neuropore at 4 weeks of intrauterine life, option B, failure of closure of posterior neuropore at 6 weeks, option C, failure of closure of posterior neuropore at 4 weeks, and option D, failure of closure of anterior neuropore at 6 weeks. The condition is anencephaly, caused by failure of the rostral or anterior neuropore to close by day 25 of embryonic life. The correct answer is option A, failure of closure of anterior neuropore at 4 weeks of intrauterine life. In question 5, you are asked to identify the marked structure in the forearm. The options are option A, flexor carpi ulnaris, option B, flexor carpi radialis, option C, palmaris longus, and option D, flexor carpi superficialis. The arrow points to flexor carpi radialis. The correct answer is option B, flexor carpi radialis. In question 6, the image shows a bone marking, and you are asked to identify which muscle inserts there. The options are option A, sartorius, option B, adductor longus, option C, psoas major, and option D, gluteus medius. The arrow points to the lesser trochanter of the femur, which is the insertion point of the psoas major muscle. The correct answer is option C, psoas major. In question 7, a congenital anomaly is shown with intestinal loops protruding and covered by a membrane. The options are option A, gastrochesis, option B, omphalocele, option C, omphalocele with enteric cyst, and option D, umbilical hernia. In omphalocele, abdominal contents herniate through the umbilical ring and are covered by amnion and peritoneum. In contrast, gastrochesis is not covered and is usually located to the right of the umbilicus. The correct answer is option B, omphalocele. In question 8, you're asked to identify the maternal component of the placenta. The options are option A, decidia bacillus, option B, chorion frondosum, option C, decidia capsularis, and option D, decidia parietus. The placenta has 2 components. The maternal part is the decidia bacillus, and the fetal part is the chorion frondosum. The correct answer is option A, decidia bacillus. In question 9, the question asks which structure forms the lateral boundary of Hesselbach's triangle. The options are option A, femoral vessels, option B, inferior epigastric vessels, option C, inguinal ligament, and option D, rectus abdominis. The triangle is bordered medially by the rectus abdominis, laterally by the inferior epigastric vessels, and inferiorly by the inguinal ligament. The correct answer is option B, inferior epigastric vessel. In question 10, you are shown the joint at the base of the thumb and asked to identify its type. The options are option A, synovial joint, option B, saddle joint, option C, pivot joint, and option D, plane joint. The first carpometacarpal joint of the thumb is a saddle joint, which allows for a wide range of movement including opposition. The correct answer is option B, saddle joint. In question 11, you're asked to correctly match structures on a CT. The options are option A liver, B, pancreas, C, spleen, option B, A, spleen, B, pancreas, C, left kidney, option C, A, kidney, B, pancreas, C, spleen, and option D, A, right kidney, B, pancreas, C, left kidney. Based on anatomical positioning, the correct match is option B, A, spleen, B, pancreas, C, left kidney. In question 12, the landmark for palpating the common carotid artery is the options are option A, angle of mandible, option B, suprasternal notch, option C, laryngeal prominence, and option D, arc of cricoid cartilage. The common carotid artery is palpated at the level of the cricoid cartilage. The correct answer is option D, arc of cricoid cartilage. In question 13, you are asked which part of the diaphragm is formed by the dorsal mesentery of the esophagus. The options are option A, pleuroperitoneal membrane, option B, crus of diaphragm, option C, septum transversum, and option D, none of the above. The correct answer is option B, crus of diaphragm. In question 14, you are asked to identify the false statement regarding the conjoint tendon. The options are option A, formed by internal oblique and transversus abdominis, option D, forms posterior wall of inguinal canal, option C, protects the superficial inguinal ring, and option D, runs parallel to inguinal ligament. While all other statements are true, the conjoint tendon does not run parallel to the inguinal ligament. It lies deeper. The correct answer is option D, runs parallel to the inguinal ligament. Let's now move on to physiology. In question 15, a patient presents with wheezing and a low FEV1 on spirometry. The options are option A, option B, interstitial lung disease, option C, idiopathic pulmonary fibrosis, and option D, silicosis. Asthma is an obstructive lung disease causing reversible airway narrowing and low FEV1. The correct answer is option A, asthma. In question 16, a man with a blood pressure of 50/90 and normal renin is diagnosed with Conn syndrome. The options are option A, metabolic alkalosis, option B, metabolic acidosis, option C, hypertension, and option D, low renin levels. Conn syndrome causes metabolic alkalosis, not acidosis, due to excess aldosterone. The correct answer is option B, metabolic acidosis. In question 17, kinesin, dynein, and myosin are examples of what type of protein? The options are option A, transcellular molecule, option B, intercellular molecule, option C, molecular motor, and option D, cell adhesion molecule. These proteins function as intercellular motors. The correct answer is option C, molecular motor. In question 18, you're asked to identify the voltage-gated calcium channel on T-tubules. The options are option A, ryanine, DENE receptor, option B, dihydropyridine receptor, option C, SERCA, and option D, troponin complex. The T-tubule channel is the dihydropyridine receptor, which activates ryanine receptors on the sarcoplasmic reticulum. The correct answer is option B, dihydropyridine receptor. In question 19, a newborn has collapsed alveoli and insufficient surfactant. The options are option A, bronchial asthma, option B, respiratory distress syndrome, option C, pneumonia, and option D, pleural effusion. This presentation is typical of neonatal respiratory distress syndrome. The correct answer is option B, respiratory distress syndrome. In question 20, a man notices his ears are colder than his body after eating ice cream. The options are option A, thalamus, option B, hypothalamus, option C, amygdala, and option D, cerebellum. Thermoregulation is the function of the hypothalamus. The correct answer is option B, hypothalamus. In question 21, A patient understands speech but cannot speak. The options are option A, Wernicke's area, option B, Broca's area, option C, angular gyrus, and option D, arcuate fasciculus. This is a classic sign of Broca's aphasia. The correct answer is option B, Broca's area. In question 22, you are asked which mechanism maintains the resting membrane potential. The options are option A, sodium-potassium pump with primary active transport, option B, Gibbs-Donnan equation, option C, sodium chloride pump, and option D, sodium-potassium pump with secondary active transport. The correct answer is option A, sodium-potassium pump with primary active transport. In question 23, you are asked which value is derived, not directly measured, in arterial blood gas analysis. The options are option A, bicarbonate, option B, partial pressure of oxygen, option C, partial pressure of carbon dioxide, and option D, bicarbonate is calculated using the Henderson-Hasselbalch equation. The correct answer is option A, bicarbonate. In question 24, a patient with cardiac tamponade shows specific changes in J. The options are option A, rapid Y descent, option B, absent Y descent, option C, absent A wave, and option D, canon A wave. In tamponade, the Y descent is absent. The correct answer is option B, absent Y descent. Finally, in question 25, you are asked which cell type is present in the center of venules. The options are option A, lymphocytes, option B, neutrophils, option C, macrophages, and option D, red blood cells. The central lumen of venules primarily carries red blood cells. The correct answer is option D, red blood cells. Let's begin with biochemistry for FMGE. In question 26, iron absorption is inhibited by which of the following? Option A, Indian gooseberry, option B, lime juice, option C, tea, and option D, sprouts. Tea can inhibit iron absorption as it contains polyphenols, specifically tannins, which bind iron in the gastrointestinal tract, thereby reducing absorption. This effect is more pronounced with black tea and to a lesser extent with green tea. Vitamin C increases iron absorption, while milk, tannate, EDTA, and phytate decrease it. The correct answer is option C, tea. In question 27, which of the following amino acids is responsible for the buffering of blood? Option A, histidine, option B, valine, option C, glycine, and option D, asparagine. Histidine, due to its imidazole group with a pK near physiological pH, acts as a buffer by accepting or donating protons, thus stabilizing blood pH. The correct answer is option A, histidine. In question 20, intracellular accumulation of cholesterol and cholesterol esters or fats is seen in which of the following combinations? Option A, tendon xanthomas, primary familial hypercholesterolemia, and strawberry gallbladder. Option B, strawberry gallbladder, Niemann-Pick disease, and abelipalproteinemia. Option C, tendon xanthomas, primary familial hypercholesterolemia, and abelipalproteinemia, or option D, tendon xanthomas, strawberry gallbladder, and abelipalproteinemia. Tendon xanthomas and familial hypercholesterolemia involve cholesterol accumulation. Strawberry gallbladder shows cholesterol deposits in the gallbladder wall. Niemann-Pick disease stores sphingomyelin and cholesterol, and abelipalproteinemia affects fat transport, not cholesterol accumulation. The correct answer is option A, tendon xanthomas, primary familial hypercholesterolemia, and strawberry gallbladder. In question 29, a patient presents with increased palm and sole thickness and tyrosine transaminase deficiency. The options are option A, type 1 tyrosinemia, option B, type 2 tyrosinemia, option C, alkaptonuria, and option D, homocystinuria. The condition is type 2 tyrosinemia due to deficiency of tyrosine aminotransferase, leading to hyperkeratosis and eye issues. The correct answer is option B, type 2 tyrosinemia. In question 30, a child has fatigue, bleeding gums, joint pain, petechial hemorrhages, and bowing of leg. The options are option A, high doses of vitamin D, option B, high doses of vitamin C, option C, high doses of vitamin E, and option D, high doses of vitamin A. The child likely has scurvy due to vitamin C deficiency, which impairs collagen synthesis, leading to fragile capillaries and connective tissue. The correct answer is option B, high doses of vitamin C. In question 31, a pregnant mother on a vegetarian diet risks which vitamin deficiency in her baby? Option A, vitamin B1, option B, vitamin B2. Since vitamin B12 is primarily found in animal products, her baby is most at risk for this deficiency. The correct answer is option D. In question 32, a patient with diarrhea, cheilitis, stomatitis, glossitis, glove and stocking neuropathy, and sun-exposed neck rash most likely has which deficiency? Option A, vitamin B12, option B, riboflavin, option C, niacin, or option D, thiamine. These symptoms are classic for pellagra caused by niacin deficiency. The correct answer is option C, niacin. In question 33, deficiency of which vitamin causes xerophthalmia and facicular hyperkeratosis? Option A, vitamin A, option B, niacin, option C, biotin, or option D, riboflavin. Vitamin A is essential for epithelial health and vision. The correct answer is option A, vitamin A. In question 34, which of the following is a precursor of niacin? Option A, tyrosine, option B, tryptophan, option C, thiamine, or option D, pyridoxine. Tryptophan converts into niacin with the help of vitamin B6. The correct answer is option B, tryptophan. In question 35, lactulose is made of which sugars? Option A, galactose and glucose, option B, glucose and fructose, option C, galactose and fructose, or option D, galactose and mannose. Lactulose is a synthetic disaccharide of galactose and fructose. The correct answer is option C, galactose and fructose. In question 36, which amino acids are essential for purine ring formation? Option A, glutamate, aspartate, valine. Option B, glycine, aspartate, glutamine. Option C, leucine, aspartate, glutamate. Or option D, lysine, asparagine, glycine, aspartate, and glutamine contribute atoms to the purine ring. The correct answer is option B, glycine, aspartate, and glutamine. In question 37, if the RNA code is CA-AG, U, what is the DNA template? Option A, CA-AG, UDT. Using base pairing rules, the DNA sequence is GTT-CCA. The correct answer is option B, GTT-CCA. In question 38, a gray top vacutainer contains which additive? Option A, EDTA. Option B, sodium citrate. Option C, sodium fluoride and heparin, or option D, sodium fluoride and potassium oxalate. These tubes contain fluoride to inhibit glycolysis and oxalate as anticoagulant. The correct answer is option D, sodium fluoride and potassium oxalate. In question 39, which enzyme is inhibited by statins? Option A, HMG-CoA synthase. Option B, HMG-CoA reductase. Option C, 1-alpha hydroxylase. Or option D, 7-alpha hydroxylase. Statins lower cholesterol by inhibiting HMG-CoA reductase. In question 40, ammonia transport from brain to liver occurs via which molecule? Option A, glutamine. Option B, glycine. Option C, alpha-ketoglutarate. Or option D, alanine. Glutamine carries ammonia from brain to liver safely. The correct answer is option A, glutamine. In question 41, which enzyme links glycolysis and the pentose phosphate pathway? Option A, glucose 6-phosphatase. Option B, glucose 6-phosphate dehydrogenase. Option C, transaldolase. Or option D, hexokinase. G6PD starts the pentose phosphate pathway. The correct answer is option B, glucose 6-phosphate dehydrogenase. In question 42, a 3-year-old with seizures, lactic acidosis, hyperammonemia, and encephalopathy likely has which condition? Option A, mitochondrial encephalopathy. Option B, urea cycle defect. Option C, glycolysis defect. Or option D, PDH complex deficiency. These symptoms match mitochondrial encephalopathy. The correct answer is option A, mitochondrial encephalopathy. In question 43, the marker enzyme of the mitochondrial matrix is option A, ATP synthase, option B, MAO, option C, fatty acyl-CoA synthase, or option D, citrate synthase. Citrate synthase is specific to the mitochondrial matrix and catalyzes the first step in the TCA cycle. The correct answer is option D, citrate synthase. In question 44, which GLUT transporter is present in skeletal muscle and adipose tissue? Option A, GLUT1, option B, GLUT2, option C, GLUT3, or option D, GLUT4. GLUT4 is insulin dependent and found in these tissues. The correct answer is option D. In question 45, which protein has a triple helical structure? Option A, albumin, option B, collagen, option C, myoglobulin, or option D, keratin. Collagen consists of 3 alpha chains in a triple helix. The correct answer is option B, collagen. Finally, in question 46, which of the following is an incorrect statement about collagen? Option A, type 1 in ligaments and bone, option B, type 2 in tendon, option C, type 2 in perichondrium, or option D, type 1 in joint caps. Type 2 is not found in tendons. Tendons primarily contain type 1. The correct answer is option B, type 2 in tendon. In the end, best of luck, everyone.